Dr. Venincasa has been providing quality dental care in a professional manner since 1986. Although his expertise is in cosmetic, restorative, and single-visit restorative dentistry, he also provides general and family dentistry. Dr. Venincasa earned his doctorate in dental surgery from the University of Texas Health Science Center in San Antonio, Texas. Dr. Mark Venincasa is here with us to discuss porcelain veneers. Welcome, Doctor. My first question to you is, what are porcelain veneers?
Porcelain veneers are these restorations that dentists can place on the surfaces of the teeth. Usually it's limited to the very front teeth and the premolars, which are the teeth that are in front of the molars. And then some people who might have a really wide smile, like Julia Roberts, perhaps a veneer might be placed on a molar as well. And they're meant for reshaping teeth, widening teeth if there's gaps in between the teeth. They can also lengthen teeth for people who might be, their lip hangs too high, and they're too low actually, and they don't show enough tooth structure, or maybe over years of time a patient could have worn down the surfaces of the teeth from grinding, and so they can lengthen the teeth in those instances. They can also whiten the teeth and brighten the smile. So there's a lot that veneers can do to change a smile. And for a lot of patients, when their smile is changed, it can really change the way they feel about themselves and how they present themselves to others.
Who is an ideal candidate for porcelain veneers?
I would say an ideal patient would be someone whose teeth are in a pretty good alignment, fairly straight. A patient who has gaps in between their teeth, patient wanting to whiten the teeth some more, a patient who has irregular surfaces on their teeth. That could be from some patients, for instance, suck on less, something they like to do, and that can damage the surfaces of the teeth by making them pitted or like eroded away. And so those kind of patients would also be ideal candidates for porcelain veneers. And patients who also don't really have much recession in their teeth, because that complicates our ability to do the veneers. It doesn't make everything a no-go. In patients who have recession, we'd move on to crowns if the root surfaces of the teeth are exposed. But in dealing with ideal patients for veneers only, they really can't have much in the way of recession. And patients who are also wanting to lengthen their teeth, because over the years they may have grinded their teeth away, or when they smile, the way that their lips cover their teeth, they don't feel like that they present or show much tooth structure. And so veneer is a perfect way that we can lengthen the teeth.
What is the procedure for getting the veneers?
I would say, the first thing that we like to do is to visit with the patient, see what their desires are. So this is going to be a separate appointment from when we actually start. So we're finding out what their desires are. We're looking at everything ourselves to make sure they're an ideal candidate. We're looking at what things or deficiencies and then we set up a time for them to come in later, within a week, and I'll actually do the veneers in my dental lab. I actually will finish out the case based upon our discussions with the patient and based upon what I know that needs to be done. And then we'll be able to make a template from that. And then when the patient comes in, generally we do have to anesthetize the teeth. I realize that some patients have been exposed to perhaps some advertising that indicate that no tooth structure needs to be removed. That over the past few years has been retracted. Some tooth structure does need to be removed. So that's why we anesthetize the teeth. And so there's really not much tooth structure that needs to be removed, because the veneers themselves are very thin. And so what we're really trying to accomplish when we reshape the teeth is just kind of roughen the surfaces to remove a little bit, so that when we replace a little bit, we don't have teeth that are too fat. We really want to try to make the teeth look natural, of course. And so if no tooth structure is removed, the teeth are going to look fatter naturally. So we have to remove a little bit in order to make everything look nice and natural. So that's done, of course, with our conventional drills. And then, of course, not much is removed, like I was saying. And then we'll take an impression. And from the template that I made in my lab, we can make a temporary that very much reflects the final result that the patient's going to have. So that very first visit, the patient's very excited because they're starting to see changes that very closely resemble what they're going to experience when the veneers are finished. And so what we do in that situation is I take a look at everything. I make sure I'm happy with the temporaries and the lengths of the teeth and the shape. We let the patient look at it. If there's anything immediately that they like to change, like lengthen a tooth or round off some edges or increase some spaces or something like that, we can accomplish that in the veneers. So then we take an impression of that and we can send that to the laboratory so that they can mimic what we've done in the temporary. And then we also ask the patient to give us a call within a week or two after they have had the temporary veneers to let us know if there's anything else they need changed. Sometimes we have them come back so that we can make those changes for them.
Are there different types of veneers to choose from?
There's different brands of veneers, and patients maybe have been exposed to different brands, but they all are made of porcelain. There are some resin veneers. They're not very commonly done, and I would say resin veneers are more specifically for patients who are on TV a lot, and that has to do with the lighting and the cameras and such that they're exposed to in their work. But for most patients, of course, they're not in that line of work, and so they're made of porcelain. And so the only difference is there is a brand that maybe they run into in women's magazines or in some other places where advertising is done for veneers, but they're basically all made of porcelain.
What are the risks to the tooth structure from veneers?
Fortunately, with porcelain veneers, there's really very little risk when they are properly done. The reason for that is because when the teeth are prepared for veneers, very little of the tooth structure is removed. So there's still the enamel layer on the tooth to protect the tooth from being sensitive. So as a result, the risk to the tooth is extremely minimal. In very rare cases in our office where we have patients that are sensitive for some reason, it's really very rare. And in those kind of cases, there's some things that we can do at times, and at other times it's a response of the tooth to the finished veneer, and it might just take a few days or maybe a few weeks for the tooth to calm down. But that's really rare because of the way we prepare the teeth for the veneers. So I would say for the tooth itself, there's very little risk. But then once the veneers are done, the only risk really is the patient taking care of them in the way of like not biting into sewing needles or nails, being careful not to knock the veneers with anything, because when you think about it, the veneers are made of porcelain, and porcelain is very similar to like china on dishes, the china, and of course if you knock china on the edge or the lip of the plate just a little bit, there's some potential for something to break off. And so that's why I was describing you don't want to bite into really hard things with the veneers because they can chip. And once veneers chip, they're really difficult to repair. The repairs just don't last very long. And so unfortunately, if a veneer chips, it basically needs to be replaced. But fortunately, from what we've seen in our practice, that very rarely happens. But that's the main risk, I would say, with veneers, is that potential for them to chip if a patient has some kind of accident or they don't think everything through and they bite into something that they're not supposed to. And then the next thing I want to also recommend is whenever patients obtain veneers, we realize it's a large investment for the patient. One way for them to really kind of protect their investment is to get a guard that they would wear at night, so that when they do clench or grind at night, those very front veneers are protected. Because without the guard, there's nothing to prevent those forces on those front veneers that can lead to perhaps some cracks or chipping. So again, I really highly recommend the night guards. We very strongly recommend that.
How long do porcelain veneers last?
We have seen porcelain veneers last easily over 10 years. In some cases, they can last over 20 years. There's really nothing like the natural tooth structure. And it does seem like at some point in time, things may need to be replaced in the way of the veneers. And what usually causes that to happen is maybe over time, as we all age, there's some potential that we can have recession. Of course, the better a patient is with their brushing and not being too aggressive, the amount of recession can really be minimized. But over the years, a patient may have their gums recede to some degree. And when that happens, that line or the junction between the veneer and the natural tooth can become apparent. And so usually there's a color difference between the color of the veneer and the color of the tooth structure. And so when they smile, if they've had some recession, that margin or junction is now exposed. And that can create the need for a veneer. So that would be a cosmetic reason why a veneer would be removed, and not necessarily because of decay or discoloration or chipping or breaking. So that I would say is the most common reason in our practice why veneers might have to be replaced. In some cases, we have patients that have had veneers made somewhere else, and the junction or the fit between the tooth and the veneer wasn't quite as tight as what we're used to achieving in our office. And so the cement fills that void that lies between the veneer and the tooth, and that cement can be in the surface of the veneer itself. And so in some patients, they might have discoloration showing up, like on the sides of the veneer, like kind of in between the teeth, or along the gum line, especially if they've had some recession, like I have explained earlier. And that can make that cement line look brown or even black. And so in those cases, the veneer would have to be replaced as well. So, but normally we've seen them last 10 to 20 years.
Is there any special care for porcelain veneers?
I would say the care for veneers is very much like a natural tooth. You can brush normally. Of course, dentists, we recommend flossing, and we still do. I know what was on Facebook. Yes, we recommend flossing, and we highly recommend it, especially with veneers. But we recommend it really for all patients. And that really just helps to keep the gums healthy, helps to resist recession because things are clean, and it just helps to prevent any potential problem as far as decay develop in near the veneer on the tooth surface. As far as eating, patients can pretty much eat what they normally eat, but like I was saying earlier, you really don't want to eat on things that are really hard because the veneer can potentially chip or crack if something's really hard. So when I think about what that might be, I know like pork ribs, here in Texas we love our ribs, and pork ribs come and fall off right off the bone. But there's time when on beef ribs, you really have to kind of bite it off the bone. I would not do that with porcelain veneers. Corn on the cob, I guess there's occasions when a patient might get their teeth end to end pretty strongly. So I'd almost recommend with corn on the cob to cut it off the cob. And that way they don't have that potential of chipping or cracking the veneers. Maybe the hard surface like candied apples, I wouldn't bite into that. You can kind of figure out what I'm talking about. Anything that's really hard, I really wouldn't bite into it. I really would try to be more thoughtful about how you're eating things, because I realize it's a heavy investment. We want patients to be able to be very satisfied and to have these veneers for a long time. So we can do everything on our end to help make that happen. But there's of course things on the patient's end that can really help them to make these veneers last for a long time. So by doing some of these things I recommended, and also by having an eye guard and being committed to wearing that guard every night, they're really doing everything they can to help prevent any problems and to help these to last for a very long time. So again, a lot of these things I was describing isn't too much different than a natural tooth. But also, like I've indicated before, there's nothing like a natural tooth. And so these aren't going to be as strong as a natural tooth. And so in my mind, we need to be a little bit more cognizant of that and really consider what we do with our teeth with the veneers.
What would be the alternatives to dental veneers?
The alternative for veneers, first and foremost, orthodontics. If there's gaps or rotations in the teeth, we always recommend the orthodontics first. And that may make us a little bit more unique because I want to have what's best for the patient, and I want to have what I would want for myself. And so we always open up that option for the patient first. Please consider getting orthodontics if there's a good number of spaces, or if there's a good number of rotations of the teeth, or if they're angled in different directions, because honestly, orthodontics is the best option. And the reason for that, it's kind of like building a house. If the land of where your home is going to be placed is not solid, if the land is at an angle or at a slope, that's going to make it more difficult to build the house the way they want it. And so, of course, when the house is built, they don't really cut corners on that. They grade the land, they put on a nice strong foundation that's very much straight and flat so that the house can sit on it and also be straight up and not off angled, or they don't have to accommodate for an angled or bad foundation in the house itself. The same thing exists for the teeth. If we have a nice foundation, good bone support, have the teeth in a pretty nice alignment, that just makes things so much better for anything that happens on the teeth themselves. And so we always want patients to consider orthodontics first. Now, I know a lot of patients want the fast option, and orthodontics is not going to be that. And so some patients will say, no, I absolutely do not want orthodontics. And we want to please our patients. We want to help them. But I always let them know what's best. We give them that option to say no, as opposed to my just wanting to hurry up and quickly help them accomplish their goal, knowing that there may be some sacrifice at the front end with the patient not knowing. So we always open up that option for the orthodontics first. And then if they say no, we talk about what compromises might occur, what downside might exist, and if they're accepting of that, then we can move forward with the veneers. So another alternative to veneers, some patients might only have maybe 1 or 2 gaps between their teeth. They might be very happy with the color of their teeth, and there's not much that has to be done other than just filling those gaps. In those cases, bonding can be done. So it's a lot simpler, a lot less involved, and something that can be easier to maintain, and certainly the investment is a whole lot less. In other cases, maybe the patient wants the teeth whiter, and maybe there's just a couple of things about their teeth that they don't really like that isn't so much adding to the tooth structure, but they might feel like one tooth is longer, or several teeth are like not all even in length, or they don't look the way they want them to look. In some cases, we can reshape, just very finely reshape some teeth, and that can make a huge difference. So without veneers, through whitening and reshaping the teeth, a huge difference can be made without having to add these porcelain veneers on, which generally involves 8 teeth or up to 12 teeth. So there are certainly other options. All of it depends on what the patient's desires are and what the conditions of their teeth are.